So, first of all, I think I will be acknowledging the land that we are getting together. So I know folks are from different places, but I'm in Calgary, and we are in the territories of the traditional territories of the Treaty 7. And the city of Calgary is also home to the Métis Nation of Alberta, districts 5 and 6. Also, I would like to acknowledge my commitment, my uh, sort of a working inspiration of equity, diversity, inclusion, accessibility, and work towards eliminating racism. So, as Sadia mentioned, we will be, this paper is the one that we are doing to chat a little bit about. Again, those who have had time to go through this one, you have seen like this is not a, like conventional research paper. You can see on the left upper corner here, it's written commentary. So it's been from our program of research. When we started, we came to know, we came to realize lots of things. And that is the thing you should know, like regarding the realization piece. So I am not, so in my previous life as a researcher, so previous from 2014 and backwards, I was a number cruncher. And I was a researcher with a laptop in a cubicle in the I think third floor of the Department of Community Health Sciences, where I crunched numbers and crunched numbers and crunched numbers. Somehow in 2014, I got this lifetime opportunity to, to do something that I thought I would love to do and enjoy doing. And there was a pure move from the TRW, at that time it was the TRW third floor, towards the communities in Calgary. And our work with the immigrant communities, visible minority communities, this led to these understandings in this paper. So these papers that I have been writing and then trying to share and trying to preach to people are based on the working experience that we had. So another thing, like I just would like to, bring up to you, because this is the way I wrap my head around. So if you think about the community, so the patients are definitely part of community, but they are not lots of time the community. To me, the community is the grassroots community within whom the people with increased risk who may not call them as patients or other components be here. And within them are the patients. So by patients, I mean those who, in my head, it means those who are actively seeking treatment for their own well-being or actively in need of a clinical treatment for their own well-being. And again, this was for me to conceptualize, to wrap my head around where I was positioning our research, where I am, because as you will always know, like definitely patients come from the community, and after getting the treatment, they go back to the community. So for me, the community, the word, anytime I use, it's more of the larger community that we belong to. So there is a reason behind that, because when we saw in our own experience, within the grassroots communities, these activities of health promotion, primary care, and those primary prevention, those are the most needed or most effective ones. On the other hand, the patients definitely they need the health service in terms of the clinical service and other social care services directly to make their life better. There is this in-between people who are more of a need of different services that will prevent them from breaking down or getting a more intensive need of services in terms of clinical and social care type of services. So this one was important for us to conceptualize when we were talking about this community engagement, because we have this word of patient engagement, and I use the word partner engagement here. And this one is the community engagement. Now, the philosophical underpinning, the good practices, they are very similar across these levels in terms of engagement. But what we found, the level of readiness to engage by the counterpart of ours, like the patients, the partners, or the community, they differ. Because the patients, when we want the research we do there, and if from the Cummings School of Medicine, as this has a characteristics of serving people as well, there we saw that patients are half sold lots of time, not always, to be engaged because there is a perceived benefit from the system towards the patient side. But on the other hand, the community engagement piece with the grassroots communities, I think this was when we went out with the communities to engage with the community, there was a much more, I will not say reluctance, much more not being used to be engaged type of scenarios. They are engaged with the religious groups. They are engaged with the communities of voluntary activities. But for research, the engagement piece was not that interesting or new or that much felt beneficial for them. So when we talk about community engagement, we talk about this piece where everybody is in it. We will be not, explicitly meaning community engagement and patient engagement is same, because to me, to us, patient engagement and community engagement have certain level of differences across them. Now, then we came with the concept of, okay, so there are beautiful definitions of community engagement. I think if you go to WHO web pages, you go to the Alberta Health Service web pages, you go to the different web pages, beautiful definitions. But in those beautiful definitions, what we saw lots of time in application wise, those definitions are not being totally justified upon. Thousands of brain power went into it, but we felt that despite thousands of brain power going into the definition, when we go to do applications or implementations or engagement in the community, it becomes a very artistic scenario rather than scientific definition itself. By artistic scenario, I mean there are lots of adaptation that needs to be done, lots of modifications based on the responses you get, lots of new things come in which you never imagined on. So those type of things comes up. So based on this experience, I think this was the first paper in this group of paper we wrote. We were trying to figure out what does this meaningful and the deep community engagement means. And again, we are researchers. Our deep engagement or the meaningful engagement are to do research, to let people do research with them and also participate in our research. So based on this, okay, this is a figure that gives you a little bit of sort of a, okay, let me check. This is a figure that gives us that idea. So these are the main points. Like, when you do the community engagement or do for research, you cannot think about parachute in and parachute out. You have to be there. You have to be part of the community. And you also be careful about not missing the mass population. And definitely you will be listening with a blank slate. And again, if you even have done a good homework, even if you have done a very, good preparation of the research background, but still there are lots of things from the community you can learn, as well as you going in by saying like, oh, I know this, and this is your problem. That's a deterring scenario for engagement. We need to be in the community to service with a no string attached. And this is the contrary, not the contrary, this is the counterpart of the patient engagement, because the service of treating people by Cummings School of Medicine is a huge thing for the patients. So they feel like, oh, I'm getting the service, I'm being treated, I'm being taken care of. I would like to give them back to some extent, and I will participate or engage for the research. And focus of the capacity building, and again, and planning to compensate, I think in different places you may have talked about different things, but I would like to focus on the first two. Now, what do I mean by continuous engagement? Not parachuting in and parachuting out. So the thing I made by continuous engagement is more of a people going in, building relationship, but when the research project is done, don't just vanish. again, we all talk about it, but what does vanishing mean? Lots of time in our era now, we talk about, no, we should be doing knowledge mobilization. But then again, the knowledge mobilization is also a one-time event, two-time event. Then what happens? If the project is done, do you nurture those relationships? Do you do some things in the community even beyond the life of the project time? So that's what I'm trying to, figure out or try to promote or to preach, that parachuting in, parachuting out is not only the completion of the project. If you have a relationship, nurture that beyond that completion of the project. It's not only the data collection piece we are referring to. It's referring to you being present in the community. Another thing is like, the not missing the mass population. So the idea was, when we went to do research and we found few friendly neighborhood Spidermans who wanted to help us with the research, for the next research project and the next research project or any activities we do, the same people come up and say, hey, I will help, I will help. Hey, I will help. And we saw our activities geared to the larger community, but the involvement was getting, limited with those friendly neighborhood Spidermans. So again, same people were showing up again and again. So that got us to think how we can reach towards the mass people, and probably the effort of reaching towards the mass people has to be inbuilt in your project. So I think most of you will be knowing this is a uh, normal curve, we call it. So if you think about this, a group of people, 2.5% in the extreme positive, 2.5% in the extreme negative, 12.5 in the middle, and these are the general. So if you think about the community, that I will help Turin doing research or his group is doing anything, the same few pays, these are the 2.5%. They are the champions. These people, even put a gun in their head, they will say, no, I don't want to be part of it. They're totally disinterested or not interested to be part of this one. And these people normally are in the verge, and these people are, living their daily life. So these are the champions. These are the, maybe we can move them towards us, this one. So for example, if you think about in any countries, there should be, a very few lean and thin people, very lean, very few, very, very obese people. Majority should be in the middle. But we know that in USA, we are seeing that, obesity distribution is getting skewed. So this concept, if you think about it, the champions, the early followers, the general community members, and the unengaged, in community engagement, we want them to be engaged towards us, the majority of the community, because without that, we will not be getting the benefit of research that we are doing, the interventions that we are planning in the community and the social sphere. So how to make this happen? So we borrowed the concept of diffusion and innovation. So we noted it down, how it worked out for us, and the idea was, we went and identified the whole community and the people we knew, and then we tried to decipher, who fills where, and through the people of the champions, our constant push was to going inside. And also, we wanted to showcase the whole community that the work we are doing, with the hope that new people from this side will become our new champions for the next projects. I just wanted to say one thing in this regards, that we were so happy that this thing, we managed to do this thing, because when we started doing the research, the same people coming again and again, we started feeling that if we don't do extra efforts to bring and connect with new people to do research with us, to partner with us, for the first time, the first project we did, it was great. The champions, and it was great. It's the first baby step. But then the second project, third project, fourth project, when the same people, we are not trying proactive push to bring new people in, then it becomes tokenism. So despite improving our reach, despite trying to get new people in, if we get the first baby step down, that's a great baby step. But if you go on repeating the baby step again and again and again, then we are sort of getting into the trap, falling into the trap of tokenism. So that's another realization for us. And then we try to overcome that. Again, we sometimes brutally fail, but our constant push for achieving or doing those things are there. And another thing that was very interesting for us to realize and contemplate upon was, okay, so to reach the grassroots communities, we partner with lots of organizations. And I think most of the scenarios are, it's a blind type of partnership. Sort of whomever we got, we partnered, we went forward. But the more we were reading about this one, we saw that different organizations had different characteristics. They are in different places of the in the community sphere. So for example, this is a breakdown of different type of organizations that are involved in the immigrant and racialized community. Definitely, we have the public sector. So for example, the governments, the local governments, they are entities who provide services. There is this private sector. For example, the banks, they do lots of things in the immigrant communities. The CIB, I think RBC, CIBC, and TD, Scotiabank, the BMO, they all have activities, but they're still the private sector. In the private sector, there are other organizations. But our main focus was the not-for-profit sector. Now, within that, there are these three groups that we found. So non-core is a term used for the organizations like University of Calgary. And then there is this informal social groups, and there is this not-for-profit organizations and charities. And within the not-for-profit organizations and charities, there are this grassroots association, immigrant service providing organizations, and general social associations. So grassroots, there are lots of charities working in the grassroots. There are lots of organizations that are serving the newcomers for their resettlement integration. And there are general organizations, for example, United Way, other this type of organizations, they contribute to the integration through different projects as well. So after understanding this one, then we wanted to see who are nearer to the immigrant communities or the grassroots communities. And then if the analogy that I use, if you think about a 10-floor building or building, so we university probably we are in the 7th floor in terms of degree of separation from the grassroots communities. And we partner with those service providing organizations. In our analysis, it looks like, hey, they are our cousins. They are not, they're sometimes the real representation of the grassroots. It's more of a, we are dealing with our 3rd floor, 4th floor cousins. We're partnering with them. Definitely, they have much more tentacles in the community compared to us. But on the other hand, they are the socio-cultural organization, the religious organization, the churches, the mosques, those organizations like, for example, theater groups or youth groups. Those are more in the lowest level. That's more of a need in the community. So when we started understanding or reflecting on this one, I think our work become far better in terms of strategizing how to reach to the community, rather than just and again, partnering with these service providing organizations is relatively differently easy because they have a structure, they have a place where we can connect them. They work in the similar fashion that we work, 9 to 5 in the weekdays. But these things are more active. These organizations are more active in the weekends, in the weeknights, in the off hours. So again, this helped us to understand how to take our research further within the community, to do it with the community and to it with this group of people. And again, that's another type of realization we had. So how to handle that? We thought about, okay, so let's take an approach that's rooted in the infinite game. So what is infinite game? It's more of, I think mainly it is more of a no rules. It's about, it doesn't matter about the players. Means, and again, there is no end. And for there is counter is the finite game. What is the finite game? There is a set type of rules, set pieces, and with an end in mind. So we started sort of I will say, thinking how we can formulate our community engagement approach for which will kill three birds at a time, for example, research, organizing, and knowledge mobilization. So what we did, so we thought about our research project is a finite game because there is a start point, there is an end point. We start with the conceptualization and we end by writing the paper. The knowledge mobilization events, that has a start point, that has an end point. And community organizing event, we do lots of summer youth activities. That's a start point, that's an end point. But all these things contribute to our community engaged research of improving access to care for the immigrant communities in Calgary, Alberta. And that doesn't have any end. All these steps contributes to that journey, and improvement is limitless. So when we started figuring out that way, deciphering these things, it helped. It helped in this way. Let me give you an example. So we want our communities to be physically active. Again, to do that, we thought about few finite games. For example, we will be doing outdoor summer cricket, outdoor summer activities during the summer. Winter, we will be encouraging and creating events for mall walking. And then we will be doing that on a circular basis because our infinite game is to improve with time the number of times people get involved, and we want them to keep physically active. Now, when we started doing all these things and all these approaches, I think this thing came up like, okay, so where are we doing it? It was very important for us to understand the community ecosystem that we are dealing with. The reason behind this one is two. You can deal the community as a black box. You do whatever you do. On the other hand, most of the time, we don't have the information of the denominator. So we needed a denominator. Are we reaching all the parts of the community? Are we systematically creating things that is excluding a group in the community? So to do that, as we don't have any data on that, and then there is no systematic data collection in a government level so that we can do a community ecosystem mapping. So we started doing our own mapping for every group of communities that we deal with. May it be a local community, for example, Northeast Falcon Ridge, or may it be a community of the Nepalese community in Canada, Calgary. So how did we do it? I think you went through it. So now this has become a very standard practice for any research project we do. If we are working with a new community, we initiate this community ecosystem mapping we use it as a toolkit. So first of all, we will be going out, we'll be Googling up, we'll be doing all the StatScan and City of Calgary type of databases, and then we'll try to find the number of the people of that community belongs here, the quadrants they are more concentrated in, those type of information, whatever is available. We will validate those information by talking to the community members, especially the leadership position holders or organizations, because every communities have this cultural organization, have their country organization. For example, South Sudanese Cultural Organization, Bangladesh Canada Association, Nepalese Community Service Association. So we validate or we get information from there. And again, then we put them together, we come up with a decent understanding about the number. Some sources get us some inflated number, some sources get us some real number. So it's a mixed scenario, but we get a decent idea, okay, so what we're dealing with. Definitely familiarizing the social culture of knowledge is important. But again, having community members part of your research project, that is also, that is easier thing to do. But again, for the non-community, for example, if I'm working with the Somalian community, I need to prepare myself with the help of our Somalian community member, research team member, to familiarize myself with the sociocultural norm. We also do a listing of recognize the community champions. So these are actors in their communities who are either in the position and influenced by president, general secretary of different organization, or they are the social media influencers, or they are how to call it, like respected members of the communities. Then we do this, try to talk to them about, okay, so can we get some idea about hard to reach community groups? I will give an example. When we did our work in the Bangladeshi community, it was very difficult for us to realize and find how to reach to the non-binary population in the community, due to the stigma, due to the reluctance about their own to come out or to engage. But we know what we failed to do. That is also an important thing for us, because the next step, we can push for that to improve. And then the community events. Easily we do that because we are trying to reach out the community, and our presence in those events helps. For example, coming July 13 and 14 in Prairie Wind Park in Northeast, there will be a big festival of the Bangladeshi community where we are taking a presentation booth, where we'll be having the banners of our research projects, where we will have our students and everything, just to showcase that into the community that we are not strangers. We do this type of work. We would love to talk to you if you have some time. Let's see. Now, without knowing, because we have resource-strapped group of people, I cannot go to every event. But again, knowing those community events, we can pick and choose the biggest one we can. And again, the community spots, identifying the groceries, identifying the sort of restaurants and everything, they help us to promote our research, do our research. Communication channels, ethnic media, that's a term we are using for that, is a huge thing, because none of the community members, especially the visible minority immigrant community members, they follow CBC, CTV, or University of Calgary's You Today. They follow their own ethnic media, because in the era of digitalization, that's very much available. We try to get a list of that because we want to connect and communicate and use that channel to reach them out. And then, the organizations, they're active in the community. So this once becomes a document that's a living document that will change after 5 years. It will change. New people will come in. This is a living document. And whenever we are doing the project, at that time, we will be just refreshing those things and go forward. And that's the main first step we now do for all of our projects, to create those. And then that's the starting point of interacting, engagement, planning, activities, execution. So I will stop there. I hope